The Trump administration started a program called DCE, Direct Contracting Entities, which allowed companies to insert middlemen between patients and the care they receive. Now, these entities may or may not have had previous experience in healthcare delivery. Some of them were venture capitalists who were just investing in the business of healthcare. There's a sense, not wrong, that since we spend trillions of dollars in healthcare, that there's a lot of money to be made in healthcare. They're not wrong. Healthcare is an over $4 trillion industry in the United States. The problem is when you allow middlemen to insert themselves in roles that can limit access to care, and then you tell them they can keep 40% of what they don't spend on the delivery of health care as profit, some people might believe you won't make good decisions. Some people might say you're placing a strong incentive not to deliver care. The outcry against DCEs was so loud, the Biden administration was forced to act. Unfortunately, they didn't act to end the program. They changed the name. It's now called ACO REACH. I love how the government comes up with names so they can obfuscate what they're doing. ACO REACH stands for Accountable Care Organization Realizing Equity, Access, and Community Health. It's supposed to encourage healthcare providers to coordinate care to improve the care offered to people with Medicare. The problem is people who have enrolled in traditional Medicare can be placed in this program without their consent or realizing it's happened. Often people choose traditional Medicare to maintain control over who is providing who they see and where their care is provided. Now, if they happen to live in an area that's been targeted for the program, or they're seeing a primary care provider who's employed by an entity that enrolls in ACO REACH, the patients are unknowingly placed in the program. What we can tell about the program with its new name is it gives more lip service to equity. It requires more reporting on efforts to adhere to health equity. But the amount of payment that can be withheld for not meeting quality standards has dropped from 5% to 2%. And the only way a patient can opt out of the program is to find a new primary care provider. Now, why am I telling you about this program? I'm telling you because we're in trouble. I'm telling you because when we start putting profits ahead of patients, we all suffer. When government starts to support corporate greed over personal freedom, we all suffer. I'm telling you because we have to begin to look at the big picture. We have to begin to fight back.